name is Lynn, I'm a medical assistant, so I'm just gonna help get you ready for Dr. Anderson today.
Okay.
Would you tell me your date of birth, date of birth, please?
9/25/88.
Perfect, thank you. And it looks like today's visit is to follow up on your visit to the ER.
It is, I thought it was about falls.
Oh, is it? Okay.
Maybe it's fall.
It could be both, yeah. Mm-hmm. Have you had multiple falls recently?
Yeah, 2.
Is that something that you've spoken with one of our nurses about already?
Today's my first day here.
Okay. Mhm. The last time you fell, what happened?
I think I forgot, that I was pumping at the gas station, or I don't know what happened. I just remember tripping over the, hose and then falling on my right hand and my right leg being still stuck on the hose.
Okay. Are you still having hand pain from that?
No. I'm surprised my wrist isn't broken or something.
Oh gosh, I'm sorry. And then the other fall, what happened?
I was in the bathroom and my legs gave out. I don't remember much, just my chest hurting, the left side of my chest, chest pain, and then I called 911.
Okay.
They were it was all in 1 week.
Oh gosh, that's not a fun week.
When EMTs come out, do they send that information, when they do tests, do they send that to the doctor? Probably not.
Usually if they take you to the ER,
they didn't.
Oh, they didn't, okay. Yeah, we don't usually get that information
Okay.
automatically. If they had brought you to the ER or something, they would usually hand off that information to the ER staff, but
Okay.
yeah, unfortunately, there's not a ton of continuity there. Any other concerns today?
Yeah, my labs from the hospital visit, it has it says potassium and chloride, glucose spiked, and then CO2 low, and could these cause weakness in chest pain or falls?
That's a good question.
Oh yeah, there's another one more. My SSM records say abnormal CT of liver,
Okay.
and then I'm just gonna ask them about that. And then UW says I have hemoglobin C disease, and then SSM say I have hemoglobin C trait. So I need to know which one, because that might have something to do with the chest and back pain that I've been having for years.
Sure. And, is this your first time seeing Dr. Anderson?
Yeah.
Alright, so I have the falls, going over your lab results, that CT scan, and then also the hemoglobin disease. Is there anything else?
I think that's it.
Okay. For your allergies, or maybe just an adverse reaction, I've got omeprazole.
Yeah.
And are you still using the UW East Madison Hospital Pharmacy? Or you could use the Walgreens on Fort and Sherman?
No, for it. I never even got my medicine from the hospital visit.
Oh, okay. What medication did they prescribe?
Prednisone and something else. I just know prednisone is important because I need it now.
Okay. Mm-hmm. Is it the albuterol inhaler?
I don't know.
That's okay. Yeah, it must be. I've got they prescribed a few different medications, the albuterol inhaler and the budesonide inhaler as well.
It's so weird. They prescribed medications at 2 different pharmacies, theirs and then Walgreens.
Oh, okay, that's frustrating. Do you want me
Am
to
I-
send?
When I went to I can't remember. Oh, when I was in the hospital, they had told me, because I forget everything, to get the medication downstairs, but they called me a cab and the cab was outside, so I had to leave the medication.
Gotcha, okay.
Yeah.
Do you want us to send those all to the same place today?
Yeah, yeah.
Sure.
If they had it, so they don't have prednisone. But they have a pharmacy here.
Yep, in this building.
Yeah.
Would that be convenient for
Yeah.
you? And they're usually pretty on the ball. They usually have stuff ready for fairly fast.
Okay.
Are you using the Valium as needed for appointments? Valium or diazepam? It's an usually
I don't use that for just appointments.
Okay.
I don't have any more. They only gave me 10. Only gave me 10.
Oh, okay.
Oh, that's right, Dr. Meisner put that in that way. My last doctor don't put for just appointments.
Okay. Are you using Robitussin? That's a cough medicine.
I never picked it up from the pharmacy.
Are you using the clotrimazole or hydrocortisone creams?
Yeah, I'm using everything that's, I'm supposed to be using everything in there.
Oh.
They already updated the address when I was in the hospital today.
Is it okay if I get your blood pressure?
Yeah. I took medical labs and that screwed it all up. I was trying to figure out how I'm getting back home. That's why I was on my phone.
No, that's okay. I know that's really frustrating because if your appointment runs a little bit long, then you gotta figure it all out over again.
No, they're just messing. I don't have a ride at all right now.
Oh, that's frustrating.
Yeah, they canceled it because they didn't think I was here, but they're not calling to ask anything. They're just messing stuff up.
I always offer to give the transportation companies a call too while you're in your appointment. I can always do it at my desk out here.
Is this a 30-minute appointment or an hour? You know?
Should be a 30-minute appointment.
Okay, that's what I was
but
thinking.
yeah. Yeah, most of his appointments are 30 minutes. If it goes a little longer than that, that's okay, but
Okay.
We'll try to
Just
get
wanna
you in
make-
and out.
I just wanna make sure I have it right.
Yeah. Your blood pressure looks good, 113/77. And then your pulse is 86, which is also good. Thank you. Are you having any pain today?
I just woke up. Usually when I wake up, I don't have any pain. It's usually after.
So you get moving for the day.
Yeah. The only thing I'm still having is like coughing and wheezing.
Sure.
My albuterol is not working.
Oh, I'm sorry. Maybe Dr. Anderson will have some more ideas for you.
Prednisone.
Yeah. And I can let you talk about this with Dr. Anderson if you'd like, but you are eligible for a pneumococcal vaccine, which is just a vaccine that protects you against several different strains of bacteria that can cause pneumonia.
Okay.
And with your asthma and lung issues, that's why you're a little more susceptible to that. If you have questions, again, I'll let you chat about that with Dr. Anderson.
Okay.
And that should be everything for me, and I'll let him know that you're ready for him.
Thank you.
Yes. It's good to see you, and I hope you have a good rest of your day.
You too.
Thank you.
Didn't I have like that is disgusting. Fresh chat. What in the hell?
you for calling Ride Help. Please listen carefully as our menu options have changed. If you are an administrator or facility, press 1. For all other calls, press 2. To continue in English, press 1. For Spanish, press. If you are calling to edit or cancel a ride, press 2. If you would like to check the status of a ride, please enter the 10-digit phone number associated with the passenger's We were unable to find a ride for you in our system. You can reach your care organization at 855-929-0790 to set.
Alicia. I'm Dr. Anderson. Nice to meet you. The computer going here.
I sent you on my chart so I wouldn't forget what to talk about.
Yeah, the nurse made a couple notes there. Yeah, I'm sure it'll take us a little bit of time for us to get to know one another a bit. There's a lot that's happened to you over the years, it looks like, but sounds like, well, there's a few issues that we gotta deal with right now. As we talk today, by the way, do you mind if I use this? It's like a AI tool that kind of listens in and does the typing and stuff for me a lot.
No,
Saves a little bit of work
I need
there.
one of those.
Okay. Well, yeah. So you were just in the hospital here for a night a couple days ago, huh? With like an asthma flare up.
Yeah, I think I was in there for 2 days.
Yeah. Okay. And they didn't find any other, pneumonias or extra bad stuff. Kind of treated you with the prednisone. Or,
Yeah, it wasn't working though,
yeah.
which is unusual.
Okay.
Prednisone always works.
Yeah. You're still coughing, huh? Are you using any inhalers?
Yeah, that doesn't work. That's why I asked for prednisone.
What inhalers are you using?
Outside of the hospital, I didn't use anything but albuterol.
Okay. Do you have any other inhalers? Like that Symbicort inhaler?
I have a whole bunch of them, but I can't remember to take that one. It's not like I only can remember stuff that is like immediate, like if I can't breathe, I'm gonna remember to take my rescue inhaler because I can't breathe. If
Okay.
I have a migraine, I'm gonna remember to take that then because I'm having an actual migraine at the moment.
Well, you can actually, I'd rather that you use the Symbicort as the rescue inhaler too. Okay?
Okay.
Most insurances, or many insurances, will also pay for that,
I have a million of them. It's just that the remembering part.
Yeah, I mean, if you got a whole bunch of them, there's really no reason to not use them, because Symbicort should work quickly like albuterol, but it also has the benefit of having, there's an extra ingredient, a steroid in there, which it's kind of like prednisone, but it goes directly into your lungs, every time, so,
I understand that, but what I'm saying is the remembering part. So I've been taking albuterol for 37 years.
yeah.
So I can remember to go to that first. What you're telling me is something that I cannot remember.
Okay, could you throw away all the albuterols and then just have the Symbicort there? So that's the only option for you?
To be honest with you, by the time I get home, I'm not gonna remember to throw away all the albuterols and use the Symbicort.
Okay.
You don't have a traumatic brain injury,
I saw you have, some memory issues.
but not a traumatic brain injury.
Well, yeah.
Okay, so you're aware of like how severe it is, like leaving food burning on stoves and stuff like that.
I don't know all the details.
Okay,
but,
okay,
yeah.
cause I feel like
Well, that's a problem if you won't remember anything I tell you today.
that's why I said I need one of those.
Well, how do you remember?
I'm supposed to have a caregiver.
Well, how do you remember what your doctors tell you then?
I usually record it.
Okay. Or if I write it down? I mean,
Yeah, but I also go through the notes.
okay.
I go through emails. That's how I remember things. Pictures.
Okay.
I keep, through my
Yeah.
phone.
How are you feeling when you're up and walking around the last couple days? Is it hard to breathe? Hard to catch your breath?
Yeah. It's hard to breathe and moving around makes it worse.
Okay. How far have you been able to walk?
I haven't left my house.
Okay. Or if you have stairs at home?
Yeah.
Okay. How did those feel, going up and down those?
Yeah. How does it feel? Out of breath.
Yeah. Okay. What are you coughing up?
Yellow.
Yellow stuff.
I just spit out yellow stuff in there.
Yeah. Do you think that's any better than it was?
No, it's getting worse. When
Yeah,
I
it's
went to
good.
the hospital, that was the first 24 hours of me being sick.
Okay.
Anytime I get sick like this, it lasts for weeks. It starts off like that, and it just
Yeah.
gets worse in the middle.
Okay. So you had problems as a kid too, you said, huh?
Yeah,
Okay.
multiple asthma attacks.
Yeah. Okay. Well, one thing we'll want to do is whenever it is you get better, we'll want to do some breathing tests. Okay. We've never done them. At least it's been a very, very long time or something. And when you have asthma like this, it's real helpful for us to know that information about your lungs and how they're working. You know, how big of breaths you can take, how fast you can blow air out and stuff. It just helps us monitor asthma.
Oh, that's interesting.
Yeah.
Because there's been like a long, this is like ongoing, and nobody's ever said that.
I saw there was some time,
It's
or
like, this
you see a lot of
happens like
doctors
5 times a year. I'm always in the hospital for asthma exacerbation.
well, they don't do it in the hospital when you're sick. You have to do it after you're better. So
Oh,
yeah. Because when you're sick, you know, the breathing tests are probably always going to look bad, but that doesn't necessarily tell you how the asthma is doing in the long run. Okay. We want to
Okay.
see how you're doing when you're not real sick.
oh yeah, I understand that part. It was just that I've had 2 doctors before for over a year, and they never suggested that. That's what I was saying.
Okay.
You're a good doctor.
Okay. So I'll write that down. Alright. And let me see. The nurse, did she do your oxygen?
No.
No, I can go grab our little machine. I'll be right back.
It's gonna say it's 100.
What? If it does, that's good.
It won't feel like it. That is so disgusting.
Alright, what? Yeah, that finger's good. Yep, 99%. Alright. And your kids are sick too, I heard? Is that right?
They're fine.
Or they were sick? Oh, they
Yeah,
were.
I'm the only one that's always, when they're done being sick, I'm still sick.
Okay. Do you smoke anything?
No.
No? Okay. Are you around
No.
smoke or dusty stuff or anything? No?
I don't think my house is that dusty.
Okay. Okay. Well, we'll look into that, come up with a plan in a bit. Otherwise, let's see, she had listed, we had some questions about, well, blood work here. I think we can run through that quick. Yeah, you had a low potassium in the hospital. When you're sick and stuff, the initial labs are, yeah, sometimes look bad, but
No,
they
it's
totally
like
went back to normal the next day
the
after you
chloride
got,
and stuff.
yeah.
It
Or
wasn't-
well,
That
chloride,
is like,
high chloride doesn't really mean hardly anything, to be honest. So, the potassium was the only one that would really get my attention at all. The chloride probably, it usually is high if you're like a little dehydrated.
okay, so
So-
that's, okay.
Yeah.
I know it said that I had like some kind of liver or some kind of abnormal stuff in my medical file, and I was like, does that have anything to do with that, or?
No, it doesn't have
Okay.
anything to do with that. I did look back at that, and I mean, you've had CAT scans of your liver, several of them in the last few years. They've all been normal. I have not seen any problems there, but about 6 years ago, you had, I guess there was an MRI of your liver where they saw something called a small little area of a thing called focal nodular hyperplasia, which doesn't it's not a big deal. Okay.
Okay.
Especially if you might have been on like birth control pills back then, sometimes those trigger that to happen, but it's not
Okay.
a problem really.
Okay.
Okay. I think your other question was about like hemoglobin disease. I don't know. Yeah, I took a look and the test about 10 years ago, you had this hemoglobin test looking for like sickle cell disease or other similar types of problems, and yeah, they found signs that you have one copy out of 2 of this hemoglobin C.
So is it the trait or the disease?
If you only have one copy, it doesn't cause you any problems.
Okay, so I have chest pain and back pain, and I just was trying to figure out, is that the because they said that's from anxiety, and it just doesn't make sense, the amount of pain that I'm in for,
Okay.
yeah.
But no, that one copy hemoglobin C doesn't cause any problems.
So it's the trait.
Yeah.
But UW has I have the disease.
Well, it might. I guess someone could interpret it that way. I put in a little note here about it being only having a copy. I guess yeah, I'll put in trait. So. What else did you have down? We talked about the cough, all the other. Okay. Then the fall, that was the other thing, huh?
Yeah,
2 falls, huh? You tripped
So,
over the gas pump.
Yeah, that was
Whatever.
embarrassing.
Yeah. Okay.
Yeah.
Well, yeah. I mean, yeah. And did you hurt anything?
I fell on this hand. It doesn't
Okay.
hurt.
Okay.
I don't know if I did anything to it, but most of my pressure was on this hand, and my right leg was still on the hose.
Okay. Okay, but the hand and wrist isn't hurting. The legs not hurting either.
My legs always hurt.
Okay. Is it
I
different?
don't think it's different.
Okay.
I just have aching legs all the
Yeah.
time.
Do you tend to fall frequently?
No, this is new.
Okay. Were both times at the gas station?
The other time was in the bathroom,
Okay.
and I just remember after I got up, I was just dizzy and my legs went out.
Okay.
It's normal for my legs to tingle and to go weak. But I just remember that my left side of my chest was hurting, and then I called 911.
Okay.
I have cameras all over my house to remember stuff, so I can find it later what they said about my blood pressure and then my heart rate and stuff, because apparently if you don't go to the hospital they don't. But I can find a video. I just gotta figure out the date.
Okay. Did you end up going to the hospital for that?
First when I was in my house, they said it seemed like it was concerning, but then when we got in the truck or whatever, they put I can't remember.
It's like an EKG.
Yeah. And they said it was a little bit high or whatever, but it was fine for me. If I wanted to go, I could go, I could go. And I just said I'll just go back home. I don't need to go to the hospital.
Yeah.
If I'm not dying, then.
Okay. Had you just gone to the bathroom, or were you?
Yeah, I had
Okay.
just used the bathroom.
Okay. And
Usually when there's like not that much circulation or something, my legs go numb and my feet tingle and stuff.
you said you felt dizzy beforehand.
I always feel dizzy when I get up quickly.
Okay. Did it feel worse than usual?
No. The only thing that was different was that I fell and that I've never had pain on the left side of my chest. It felt like I was getting punched.
Okay. And it sounds like you didn't pass out.
I don't remember.
Like, do you remember falling?
I don't. All I remember is my chest. The left side of my chest. I feel like I was getting punched.
Okay. Did you hurt anything with that fall? Did you?
I don't think so.
Did you bite your tongue or have any other
I don't think so.
Or did you haven't, I don't know, you wet yourself or you had a,
No, I didn't. No,
I guess you had
I
just.
would already. I already used the
Yeah.
bathroom.
Okay. Yeah.
Usually when my legs are weak, I just go over the sink and just stand there until I can have circulation or whatever. Until I have feelings in my legs. But this time, it was just different because of the left,
Yeah.
the chest pain.
Okay.
I know chest pain is not abnormal for me, but
Okay.
on the left side, it just felt different than any other time.
Okay. How long do you think that pain lasted for?
I don't remember.
Like, I mean, like an hour or just a
I
short
don't-
time or no idea?
I don't remember.
So you did have a visit to the emergency room a few weeks ago with, well, I guess pain and then it went up into your chest.
That's normal,
So that's normal for you? Okay.
probably. Most
Yeah.
likely chest and back pain at the same time is normal. So
Okay.
it's been like this for years.
Yeah.
But if it's
And
just
they-
chest pain, that's weird.
Okay. And you've had the lung x-rays lately, which looked good. Let me see. Sounds like they did a EKG, which was fine.
They do those all the time. That's why.
Yeah, although I don't see one. At least UW hasn't done one in a year or
Well,
so.
I usually go.
Oh, here,
I go. I
St.
usually go to
Mary's.
St. Mary's for a hospital.
Yeah, St. Mary's.
They're always fine.
Yeah, looks good. Okay. Have you ever passed out in your life?
No,
No. Okay.
not that I remember.
Yeah.
Maybe when I was beating my head.
Yeah.
That's probably.
Do you do that a lot? Beat your head?
I said when I was beating my head in 2020 with Brian's knuckles, and I was bit. It was in my doctor's notes. That's probably where they're.
You were doing that? Or
Somebody
someone
beat me-
else?
beat me.
Sorry, yeah.
Yeah.
Oh, okay.
I don't beat myself. The only thing I do is pull my hair.
Okay.
I can't stop pulling my hair. That's why I don't have any hair because I have to cut it off because
Okay.
I will pull it. But for some reason they have alopecia in there and I don't have alopecia.
Okay. Well, if you lose hair, I guess it's always a form of alopecia.
Well, self-harm from autism is not alopecia. It's called something with a T.
Well, trichotillomania is.
That's what I have. That's what
Some
I-
people actually like chew on it, or.
I just pull it out.
You don't?
It's a sensory thing.
Uh-huh.
I'll keep pulling it even until it hurts because it's still kind of, it does something. It feels good.
Yeah. Okay. So you shave your head basically, or cut it?
No, I get like barbershop cuts, but right now I don't have a barber, so I'm just pulling it. Like I spend most of the day just pulling it. It's hard for me to like move on to something. I'm just pulling it. Maybe
Really?
I'm stressed.
Okay.
I don't know where it's from, but
Alright.
I can't stop doing it.
Well, why don't you come over here and have a seat? So check things out here. With this cough, I mean, do you also have like sinus problems? You know, drainage,
Yeah, my nose is running.
congestion, you know, sore throat? No.
It hurts.
You see your eyes?
Cough.
Okay. Hurts when you cough. Yeah.
Yeah.
Okay. Your eyes look normal, and the pupils too. Do you mind pulling the mask down for me? And open your mouth up and say ah. Okay. It's a little hard to see all the way back there. Okay, try again. Say ah. Yeah, even then, huh? Kind of crowded back there, but I mean the parts I can see look normal, pretty pink and moist. And let's check your nose quick too. Just look straight ahead there, and then I'll look at your inside. Okay. Maybe a little swelling back there, pretty far back, but it's not red. Can't right now at least see any mucus or something in there. Check your neck. Alright, I don't feel any lymph nodes. Let me listen to your heart here. The heart sounds normal, beating steadily and no murmurs. Could you take some big breaths with your mouth open? Maybe not quite such a big breath. See if we can avoid the coughing. Yeah, just wheezing all over. Nothing in any one particular area. Let's see. I guess with you having that pain in the chest a little bit ago, I guess you might have like press on here. Do you ever notice that it hurts? You know, if you press on it or something?
No.
No, okay. Or if you take a big breath, does it hurt a lot? No. Okay, I'm gonna look at your legs here too. See if there's any swelling. Alright. Yeah, looks good. Well, you can have a seat back down here. Oh wait, I forgot to, with the fall, can I have you stand back up again? Just see you walk a little bit. Alright. Can you get up on your tiptoes? Your walking's normal. Can you go back on your heels? Okay, good. And then you
Almost just fell.
just stand there, put your feet a little closer together, and then just close your eyes and just stand there.
Is it uncomfortable?
Okay. Yeah, you can open your eyes.
I'm talking about my legs.
Can you? That was okay. Can you lift your leg up? We'll kind of check the strength here. Then this one here, and then push against me like you're kicking. Then this one, and pull back the other way. Good. Pull this one back. All right. Yeah, your strength is fine. Just do your reflexes as well. I'll just kind of lift your leg up here. You try to relax. There we go. And sorry, I should have done this up there, but. That moved okay. And then can you feel me touching just the tips of your toes down here?
Yeah.
Yeah, okay. That's good.
I recently had a visit with podiatry, and they said there's something wrong with my balance and something else. I should have like some kind of shoe or something.
A podiatrist said that?
Yeah, I'm supposed to have
Okay.
like, I have my feet like molded, and
Oh yeah?
before they said one leg might be longer than the other one.
Okay. Yeah, I don't have those records. You know,
it might be.
Some of the podiatrists in town aren't in, you know.
It might be from SSM. Maybe that's why.
Doesn't look like it,
It
no.
has to be because I was just recent. I don't have any other providers other than UW and SSM.
Yeah? Or, I mean, you saw an orthotics person that wasn't actually like a podiatrist.
Oh, maybe that's.
I
But
don't know.
maybe that's why. Because my doctor was doing my feet because I get pain on my feet,
Yeah.
and she was doing.
Oh, or no, you did see sorry, you saw a podiatrist like 6 months ago.
Oh, it was that long.
That's what it.
I have a bad perception of time.
Yeah, I guess, yeah, it was back in March, so. Yeah, I said you had tight calf muscles and then, yeah,
I
just a
see
little.
PT, and then PT came to my house, and then they said they don't see the point of me having PT, and then they didn't do anything, and then they left.
Okay.
Sounds
Yeah, but
horrible.
then you saw the person who does the orthotics, the custom
Yeah.
things,
Yeah.
like 2 months or a month and a half ago.
Oh, they haven't ever said anything to me. Maybe my insurance.
It said, yeah, they had to have insurance authorization, so I don't know.
Yeah, they haven't told me anything.
Okay.
And my insurance doesn't authorize anything. I might be just stuck here today because of the ride.
Yeah.
Yeah.
They got your ride here though.
Yeah.
Yeah. Okay.
Yeah. I've been emailing them since I got in the room earlier.
I don't know. There's no notes about the orthotics
That's-
after that visit, so I don't know what's going on with that.
I'll remember again in a couple months.
I'll write down. I mean, you could call the orthotics department and ask if there's any new information.
The information was probably relayed to my nurse and case manager that doesn't do anything. I have a PLA now. What can she do so I don't have to?
We only activate that if you cannot make
It's already
decisions for
activated
yourself.
at the hospital.
No, you have it on file. That doesn't mean that it's activated.
They didn't tell me that.
Yeah. So we can only activate it if we think that you are incapable of making your own medical decisions. Yeah. You can choose to have a power of attorney for financial reasons, that you can give them authority to manage your finances, your money and stuff, but
Okay, so a POA is not somebody who would help me with my medical stuff because I don't have it. It's not somebody that can. Who would be able to help me with my medical stuff because of my.
people can help you.
But I don't have anybody, so who would be able to make decisions?
If you're able to make your own decisions, you make the decisions. People can give you advice.
Okay, so you're saying I would have to be completely unable to make any decisions on my own.
I mean,
I'm so
that's maybe
confused
sort of an extreme way of putting it, but you are unable to understand what your doctors are
I don't-
telling you
I don't understand.
and be able to
I'm not able to even the stuff that I was used to do. I'm not able to do anymore. I'm losing my words and stuff like that. I'm not understanding.
okay. Well, I would certainly not be able to say that you're incapacitated right now. I would, especially at your age, and our conversation has been pretty good so far. I'm not getting in it.
Yeah, I'm not so I have to be incapacitated to have a POA is what you're saying. That doesn't sound right. That sounds like a
No, that's always.
guardianship.
It's guardianship is like
That
it's
sounds like
different
a
where
guardianship.
the court orders that.
Yeah, okay. Because I remember Dr. Meisner talking to somebody before about guardianship, and that one was one where it said incapacitated. But you're saying a POA needs to be incapacitated? Because my grandmother's
Yeah.
not incapacitated, and she has my aunt as a POA.
It can get confusing. Just when you fill out the form doesn't mean that that person actually makes decisions for you. It means that that's the person that you want to make decisions for you in the future if you can't.
Got it.
Yeah.
So, I'm
So
pretty
we're
much-
planning ahead for the future if you can't do it someday.
So I'm still screwed.
So
Because I need
if you
help.
want,
I'm supposed to have people coming on medical appointments with me, making sure this stuff is happening. I don't have that.
you don't have to have a power of attorney to.
But I don't. But
So-
it was like she was going to help me with those things. I don't have anybody else to help me with those things.
Who was gonna help you with those things?
My aunt.
Okay. So she still can. She just doesn't have to be your power of attorney.
So how
To
is she
to
able
help
to
you.
like communicate back and forth with doctors without being on paperwork?
So if you haven't filled out, no, let me look.
Because
There's another form that just says that she can talk to us.
okay.
It's called
But-
the authorization for communication.
Okay, I can do that, but it's not just you. I have a nurse and I have a case manager.
Well, each
with
so
my
each organization, like UW, will have our own form. Yeah,
Release
your
of information.
casework, something like that,
Yeah, okay.
basically. And then the insurance or whoever, they're a separate organization, so they need a separate form for you to tell them it's okay for them to talk to her. You know.
Okay, so if I fall tomorrow and I'm incapacitated, whatever you just said, then she would take over. Because they told me that they put it on file at UW at the hospital.
Yeah, if you're in a terrible accident and you're in a coma or something.
Okay,
Yeah.
okay.
That's
Got it.
Yeah.
Okay.
But right now, we have your sister is your emergency
I haven't
contact,
talked to
I
my
think.
sister in 2 years.
Or wait, let
She's
me
my,
double.
yeah, she is, yeah. I haven't talked to my sister in 2 years.
If you want your aunt to be that, then, well, no, it is down
My
here,
aunt
but
doesn't
it's.
live in Wisconsin, so.
But, I mean, we can still call her.
Okay,
She can't just be here, you know.
okay.
Yeah.
So you would call her.
Is that Michelle?
Yeah,
Okay. But yeah, otherwise we have Danielle and Jerome
they're
as your
worthless.
emergency contacts. If you want to, you could remove them.
Yeah, you.
You can just talk. I can't do that. You have to. Our schedulers are the ones who handle that kind of thing. So I'll just make a note for them to do.
I need to figure out how I'm gonna get back home.
All right. Well then, so the other issues we have going on, I guess, right now is the. Sorry.
That's okay. I'm still trying to figure out how to
Is
get
it-
home.
So the asthma stuff, I wrote down to just get rid of the albuterol, only use the Symbicort, okay? And then,
And that's gonna help me for when I get sick because I don't have
Yeah.
these problems when I get sick.
yep, that will help when you get sick. Should even work better than albuterol. With the amount of wheezing you're having, yeah, we can extend the prednisone a little bit. I mean, you should still be taking prednisone, right?
I forgot to pick it up.
Oh, you never picked it up?
So I went
Okay.
down, so they made it to where at the hospital I would get it right away.
Yeah.
We went down, me and a CA had something to get it, and they had got a cab.
Okay.
The cab came, and I had to leave right away. So
Okay,
it
do you want me to
wasn't-
send it right here?
I already
to our
asked,
pharmacy
yeah, I
here?
already asked her to do that.
Okay. Well, she had Walgreens penned it as the pharmacy, not ours here.
But I asked her to put it here so I wouldn't forget.
And do you want the? Do you normally use Walgreens though
And
for other things?
Yeah, since
Okay.
my insurance changed, yeah.
All right.
I had my stuff delivered because I forget it.
Okay.
I'm gonna see if this is a ride. Hello,
Hi, is Labrisha available?
is this for a ride?
Oh, no. This is Eddie from the elementary school, Lindbergh. How are you?
I'm at a doctor's appointment. Can I call you back? In 10
Yeah,
minutes?
please do. You can. Yeah, for sure. Call me back at this number, and I'm here until 4.
Okay. If I don't call you
Okay,
back,
awesome.
if I don't call you back, can you call me back? I might forget.
Yeah, for sure. And then also too, just real quick, I just was given a friendly reminder to complete enrollment and registration for the kids. So if you needed any kind of help with that, give me a call back. If not, it's just done right online. And since the kids were here last year, it should be relatively easy.
Okay. Okay.
Yeah.
Thanks.
And then yeah, no problem. Give me a
Okay.
shot. If you need help, I'm here for you. So
Okay. Thanks.
cool. Yeah, no problem. Thanks. Bye.
All right. Well, I think that's what we can cover today. So I'll just stop at the checkout desk. They'll work on our next appointment. I think I wanna see you in like 6 weeks, so they can schedule that. And then, I'll give you the printout that has the stuff we talked about, the changes we're doing, okay?
Okay, what are we seeing for 6 weeks? Asthma?
Yeah, everything.
For everything?
Yeah. Well, whatever we can do at that time, okay?
Okay.
Yeah,
Alright.
alright. Great to see ya.
That's what I don't have time to do. I better take it. What did we accomplish today? Nothing. Checking out.
See, what time was the appointment today? Last night?
Yeah.
Is it Gersha?
Yeah.
So it looks like return in about 6 weeks.